Hello everybody, Dr. Maureen Mason here with 3 quick minutes on the lumbar spine, pelvic, and hip connection. You can see me at Yellow Women Ranch on March 16th at the health fair to learn more about the interconnections and get some solutions for common problems that happen here. First of all, I want to mention multifidus muscle. There's a little teeny tiny muscle that goes from the spinous process, the tip of the vertebrae, over to the transverse process on the next one. Multifidus is the hidden deep core, and it helps rotate, a little bit of sachet in there, and it stiffens and holds when we do things. It also has to let go, and it has to let go for rotation. So there's very gentle exercises that you can do for your multifidus muscle, and then scaffold and build up. And keeping hydrated and eating really well will help your lumbar spine too. Okay, pelvic problems are pretty common with bladder problems, more so for women than men, but we can leak with coughing or sneezing, or we can have urgency where we're not leaking, or urge incontinence where all of a sudden, gotta go. And there's many strategies for this. We always start with lifestyle factors, and then that's how much you're hydrating. Underhydration causes constipation, which causes bladder leaks and urgency. Overhydration can, of course, lead to bladder leaks from overfilling the bladder and also not paying attention to it. The hip muscles that rotate our leg in and out attach deep into the pelvic floor, deep into the front here. Here's the hip muscle, the hip rotator. They attach deep in where the bladder is. And sometimes when those are weak, we can basically have difficulty standing on one leg. And that muscle's going way out to the side, obturator internus, but on the inside, it's supporting the bladder. So studies have shown that by strengthening those deep hip rotators, we can actually improve our pelvic floor strength and function. So pelvic floor strengthening can be appropriate and help the hip. And also, sometimes people are too tight. They have spasm in their glutes, spasm in their hamstring, too tight in the pelvic floor. And that can also cause problems because you can lose flexibility, you can have pain, trouble lying on your side, trouble sleeping, and also problems with intimate functions too. So pelvic floor functions are shown with how your digestive is, how your bladder is, how your intimate functions are, and see me at Yellow Women Ranch for more details.